What is caput succedaneum? A. It is birthmark. B. It is swelling on the face of baby. C. It is collection of fluid under the scalp. D. It is swelling which not cross the suture line. And the correct answer is C. It is collection of fluid under the scalp. Diffuse edema of the fetal scalp that crosses the suture line is called caput succedaneum. It occurs in cephalic presentation when head compressing against the cervix during the delivery, which hold up venous return, forcing serum into the interstitial tissue. The swelling reabsorbs within 2 to 3 days or 36 hours. Before birth, which of the following structures connect the right and left auricles of the heart? A. Umbilical vein. B. Foramen oval. C. Ductus arteriosus. D. Ductus venosus. And the correct answer is B. Foramen oval. Auricle term is used for atrium of the heart. Foramen oval is a temporary opening between right and left atrium of the heart. It permits blood to flow from right atrium to left atrium to bypass the immature lungs. It usually closes shortly after the birth. Its failure to close may cause atrial septal defect. A closure of newborn's foramen oval closed by A. A decrease in the aortic blood flow. B. A decrease in pressure in the left atrium. C. An increase in the pulmonary blood flow. D. An increase in pressure in the right atrium. And the correct answer is C. An increase in the pulmonary blood flow. Foramen oval is usually closes shortly after the birth as a result of hemodynamic changes related to respiration. In a newborn, the anatomical closure of ductus arteriosus occurs at A. At birth. B. At 3 to 4 days after birth. C. At 10th day of birth. D. At 15th day of birth. And the correct answer is C. At 10th day of birth. Ductus arteriosus is a blood vessel connecting the main pulmonary artery and the aortic arch in the fetus to permit bypass of fetus lungs. Normally, the functional closure of ductus arteriosus occurs soon after the birth, within 18 to 24 hours of the birth. Anatomically, closure occurs in few days to weeks of delivery. It may be 10th day of the birth. The first stool of neonate is called A. Sebum. B. Lanugo. C. Meconium. D. Vernis caseosa. And the correct answer is C. Meconium. Meconium is the first greenish black, almost odorless, viscous and sticky fecus of a newborn. It is made up of salt, amniotic fluid, mucus, bile, lanugo and epithelial cells. The first meconium stool should appear during the first 24 hours and should persist for about 3 days. A newborn cry vigorously and extremities are pink, which is not required in such condition. A. Wiping the baby. B. Covering the baby. C. Oxygen therapy. D. Nasal clearing. And the correct answer is C. Oxygen therapy. In case of newborn's vigorous cry and pink extremities, there is no indication of cyanosis, so no need to give oxygen therapy. Appropriate time for toilet training in the children is A. 0 to 1 year, B. 3 to 6 years, C. 6 to 9 years, D. 1 to 3 years. And the correct answer is D. 1 to 3 years. The toilet training means teaching a child to control urination and defecation. Toilet training is not advisable to begin before 18 months because child does not have adequate neuromuscular control of bowel and bladder function until the end of 18 months. At 3 years of age, the child can withhold and postpone his bowel movements. Which of the following is used for assessing the pain in children? A. Brief pain inventory, B. Numerical rating scale, C. Visual analog scale, D. Wong-Baker face pain rating scale. And the correct answer is D. Wong-Baker face pain rating scale. Wong-Baker face pain rating scales use visual representation of smiles or grimaces to represent the level of pain which is felt by a critical sick patient and small child. Wong-Baker face pain rating scale developed for pediatric use specially. A 3-month-old baby is on nil per orally for surgery. A nurse attempts to comfort him by A. Administering acetaminophen, B. Encourage parents to leave so the child can rest, C. Offering pacifier, D. Giving 10 cc Pedialyte. And the correct answer is C. Offering pacifier. NICU stands for A. Newborn Intensive Care Unit, B. Neonatal Intensive Care Unit, C. Neonatal Intermediate Care Unit, D. Newborn Intermediate Care Unit. And the correct answer is B. Neonatal Intensive Care Unit. If newborn baby does not breathe immediately after the birth, then nurse flick baby's A. Tip of toes, B. Palm of hands, C. Sole of foot, D. Tip of fingers. And the correct answer is C. Sole of foot. If newborn baby does not breathe immediately after the birth, then give tactile stimulation by flicking the sole of the feet or slapping or rubbing the infant's back to stimulate breathing.